Hello, I'm Judy Stiles. Thank you for joining us today on Newsmakers. Well, health concerns have been high at the top of many people's minds, of course, with the pandemic, but locally we have an organization that's been doing that for many years and helping people in our community, the Community Clinic of Southwest Missouri. And joining me is Stephanie Brady. Thank you for being here today.
Thank you for having me.
Let's start off for some people, just a little background of the mission, why we have the Community Clinic here in Missouri.
So the Community Clinic serves the uninsured of our community. Basically, 100% of our patients do not have insurance. 80% of those are the working poor. They make too much money from Missouri Medicaid and they can't afford marketplace insurance. And we are there to really help them continue to be vibrant individuals in our community and take care of their health needs so that they don't have to worry about where they're going to be able to afford that. And this is our 27th year, so we've been doing this for quite some time.
Now, have you seen an increase? You said, people, the working poor, the people maybe have lost their jobs where they had medical insurance and no longer do in the last few months?
Yes, we've actually had quite a number of individuals who've never accessed our services before who are now reaching out to us asking for assistance with their care, whether they are, sick and they're just needing a one-time visit, or whether they've been managing, maybe a chronic condition for years under insurance and they no longer have that insurance. So we're there for them either way.
Now, Southwest Missouri, define the area that's served. People who are watching throughout the whole region, what are we talking about here in this area?
So we're very open to Southwest Missouri. Pretty much all of the about 6 or 7 counties in Southwest Missouri. We go all the way down to the Arkansas border, and then we also we have people from Dade and Barton counties that come to us. We also serve some of southeast Kansas as well. So if they're able to get to our clinic and they don't have insurance, then we're able to serve them.
So the state line doesn't necessarily stop people from having that service and tying that together. So the people that have you seen in the number of increases beyond just the pandemic over the years, the trend increasing before everything happened this year?
Definitely, and I think part of it is just word of mouth of realizing that we're there. For so many years, people thought that individuals had to live in Joplin in order to be served. And whenever people realize that that's not the case, that they can be from outside that area, then that opened up. Also, we have more and more people who they're working, but their insurance is no longer covered, or they may be working part-time and don't have access to that insurance. So the more that some of those kinds of narratives have changed in our society, we've seen more and more people who are needing that insurance.
How do you find
that serve?
How do you find that people find out about your organization? Is it word of mouth? Is it referrals or anything?
It's kind of both. We have a lot of patients. We have about 2,200 patients on an annual basis who consider us their medical home. So it can be, a lot of those individuals say, I've had a wonderful experience at the community clinic. You should get that, you should go down there and get services as well. But a lot of it also is, the other social services in our community. They know about us. We partner a lot with those social services. So a lot of times they have somebody who they find out has a health care need and they refer them into us. So, we just try to be there either way.
So you're able to deal with a lot of different services and a lot of preventative care as well as you said, taking care of existing conditions for people.
Correct. We have our primary care that we're able to provide for our individuals, but we also have a range of about 8 different specialists that come into the clinic. So we have pulmonology and cardiology and gynecology, pediatrics, orthopedists. We have all kinds of different people who come into the clinic, and those are doctors who, if you had insurance, you'd want them to be your doctor because they have a caring heart and they want to do what's best for people. So we have these wonderful doctors who come in, and even though you come in for, maybe a sinus infection this week, you find out you have other issues, we're able to care for that whole wide variety. But we also have a patient advocate who helps with prescription assistance. We have a social worker who is able to help, if they find out that this family is, maybe they're having some difficulties with employment or they're having difficulties with financial needs related to, being able to purchase food for their family. They work with them on different types of referrals as well.
So let's talk a little bit about some of the services, and I guess people might be wondering ages. We're talking people of all ages, children on up?
Pretty much. If they have Medicare or they're Medicare eligible, that's kind of the cutoff.
Right.
But we do have some people who, for whatever reason, their Medicare didn't, they didn't qualify for Medicare. Maybe they are a legal resident of this country, but they are not originally from here, so they may not qualify for Medicare. So we have a small population of individuals who are in the senior citizen range that do come to our clinic. But for the most part, birth through around 64 is our typical age range.
So some of the services, you mentioned the medical aspect. So you have a lot of doctors who are volunteering their time, basically. And then people say, how does this work? You know, you have volunteers, really.
Exactly. We have a part-time nurse practitioner. She's the only paid medical provider in our clinic. The rest of them are all volunteer. So, you know, we have people, like I said, who are just really dedicated, and we have relationships with both Freeman and Mercy hospitals locally. We're able to divert several people from their emergency room, so they're able to support us with our clinics as well. So, you know, we have these doctors who just come in, and some of them come in on a monthly basis, some of them come in on a weekly basis. Our endocrinologist, our diabetic specialist, is there every single week providing care for individuals. Diabetes is our #1 diagnosis, and we have a lot of people who struggle with that, so he's able to help them very closely. We also have a nutritionist who comes in, and she works especially with the diabetic population and helping them to learn how to cook nutritiously, how to shop nutritiously for their diabetes. And we also have cooking classes that people can come in and they can learn how to do that.
So it's more than just, we're going to treat this illness or this disease, we're going to help you with your lifestyle or what it takes to take care of yourself.
That's one of the beauties of the community clinic and being a nonprofit in the community is, you know, even though our mission first and foremost is healthcare, we're able to see beyond the medication and the doctor side of that. We're able to say, okay, what else do you need to allow this part to work? Because a lot of times, you know, they have other struggles that make it to where it's hard for them to be compliant with their medical recommendations. So we really try to look beyond that and help them in a lot of ways.
Now, medical services, you also have dental services as well.
We do. Our dental is very limited because the only thing that we're able to do is dental extractions and pediatric sealants. But we have, you know, even with that, we have about 6 volunteer dentists, and we do 65 to 75 extractions every month. And, you know, a lot of times people put off their dental for a long time.
I don't want to go to the dentist.
And, you know, by the time they get to us, they really have major issues, and then once they realize, oh, you know, this can be taken care of, it really helps them with a lot of pain and different types of things.
And we've heard a lot through the pandemic as far as medicine in general, like going to a lot of telehealth where you don't necessarily have to go to the office to see the doctor. Has that affected the clinic as well? We
very quickly learned about telehealth. We had never done telehealth before, and we converted partially to telehealth with the pandemic. You know, luckily, since we don't bill insurance, we don't have to. You know, we're not. A lot of people are very concerned about how to do telehealth in the insurance.
We're going to bill somebody because we're not talking to them.
Right. And with our clinic, we don't have to worry about that side. For about 2 months, we did about 75% of our visits through telehealth, and now we're doing about 50% of our visits through telehealth, and it's working really well. We found that some of the patients are, you know, they're a little bit more compliant even whenever they're, you know, do I drive from Pineville to Joplin for an appointment, or do I call? And you know, not every visit is easily done by telehealth, but those that are, it's been very, very effective for us.
So adjusting just like the rest of the medical field has been able to do. You mentioned pharmacy, and of course that's part of the treatment at many times. So people might be curious as far as pharmacy services, how that ties into, you know, you diagnose something, well, we may have to get some medications.
Right. We provide all of the medications as well. So we have a fairly significant formulary. We don't do any opioids or any controlled substances, but we provide for their needs. We have an on-site pharmacy. So if a patient is, you know, coming to us, they either pick up at Walmart pharmacy, or they come to us and pick up their medications from us as well.
So tying that, and a lot of times people, the educational aspect of prescriptions could be a challenge. You know, you go to the doctor and they'll say, take this, but you have to kind of sometimes teach how to take it, what to do, or why you're taking it. Is that part of the process as well?
Very much. So anytime a patient is seen, before they leave the clinic, they actually sit with one of our discharge nurses to make sure that they understand everything that the doctor talked to them about. They understand any lab work that we may be sending them off for, and that they understand their prescriptions. And that is a huge issue that people, you know, they don't always understand that. And it can be very, you know, if you have 6 or 7 different medications, understanding when to take different things and how to take them is a big issue. So we work really a lot with patient education and give them a lot of materials to help them to understand.
To understand what their process is. And of course, people are probably curious as far as COVID-19, how that is affected. I mean, people ask, do you do testing there? How's that affecting, you know, the operation of the clinics? So discuss that.
Well, and basically, you know, we have done moved to telehealth to a degree. We are limiting the individuals in our clinic. We are, historically, we are a cooling and a warming site for the homeless. Right now, we've had to shut that down because we are only allowing individuals who have appointments in the clinic at that time.
Right.
We are taking temperatures of anybody who comes in, and we are pre-triaging or screening them. We are doing testing. The only testing that we are doing is the antibody testing. And that's mainly for our staff, and we're partnering with all of the other nonprofits in town that we work with on a regular basis, and we're doing a lot of the screenings for their staff. With that antibody test, it's really looking at historical. Have you had it in the past? And it suggests some level of that you may have some level of immunity to it.
Right.
There's some things coming out with the CDC that we're not sure how long that immunity lasts, so it can be a false sense of security. So we're trying to be cautious of that, but mainly that's for our partners in the community.
Well, speaking of community, I know you're a big part of the community, but working with other community agencies, and people might be curious about the academic side of things. We have Missouri Southern, we have KCU, how those programs might be able to assist, or are they assisting the community clinic as well?
We're very, very blessed to have extremely positive relationships with our universities in town. One of our relationship with Missouri Southern has grown significantly in the last few years. Our Spanish language, we have a large population of Hispanic families who come to the clinic, and having the relationship that we have with the foreign language department at Missouri Southern has been tremendous, because we have people who are native speakers who are coming in and translating now for our patients, and to see our patients light up and realize, oh my gosh, I totally understand what they're saying. It's not somebody who kind of knows the language, it's somebody who really knows the language and who can answer their questions and can translate 100% what the doctor is saying. So that's been wonderful. We also have social work interns that come, and we have one that's starting in August that we're really excited about, but we've had the social work interns for 2 years, and that's been wonderful for us. They partner with our patient advocate and help our patients seek out those other resources. We have the dental hygiene program we work closely with, as well as the nursing program. We have nursing students who come out and they gain experience in the clinic. And a lot of our nursing students get very excited because, if they are going to other locations, a lot of times it's just, here, you stand back here and watch
me do this, right?
and the community clinic, they're able, if they have had like their shot experience and things like that, or they've had their blood draw experience, they're actually able to do those in the clinic.
So they're getting the hands-on experience at the clinic.
Right. And the same thing with our KCU partnership. They're working with us for early clinical experience for their doctors, or their student doctors, and they're coming in the clinic and they're gaining that experience as a second-year student, and they're getting to see real patients instead of an actor. So it's very beneficial to us, and I think it's also very beneficial to our partner universities.
Well, working with community agencies, give an example for the viewers as far as what agencies you might be collaborating with or sharing information with, or helping the patients through their efforts.
Sure, we partner very significantly with a lot of the nonprofits, especially Children's Haven, Lafayette House, Habitat for Humanity, Economic Security, Choices Medical. So we get a lot of flu shots every year, and we go on site to all of those locations, and we give flu shots to their residents, their participants, and their staff and volunteers. For instance, with Children's Haven, a lot of times their staff have to have physicals, so they will come to the clinic and get their physicals. So we try to partner in a lot of different ways to work with them. We're able to get a lot of prescriptions donated to the clinic. So we'll get prenatal vitamins and we'll take them to Choices or to Lafayette House. And we really try to share resources. We have a wonderful community of nonprofits in this Joplin area that work really well together. And recently we were able to get a good number of masks donated. So we shared those masks with the Y and with Children's Haven in different places where they are, still seeing people and still having to work closely with individuals.
Well, let's let the audience know a little bit about how people make appointments, or what do they do if they need to come to the clinic. Kind of take us through the process for somebody who's watching and say, well, what do I need to do? I'm interested.
Sure. So basically, somebody can call up and say that they're interested, and we do have a packet of paperwork that they have to fill out. Right now, they're able to come by. We're open Monday through Thursday, and they can come by during that time and pick up a packet of paperwork. They can fill it out on site, or they can bring it back, either one. We do have our website that has a patient portal on it that allows them to request information through that as well. To get a new appointment for an established care appointment. So say they're fine right now, they're not actively sick, they just are wanting to establish care with a doctor or provider. That takes about 2 to 3 weeks, so not very long. If they have a sinus infection or a cold or a toothache or something like that, those appointments are much quicker to get in. We do walk-in appointments 3 days a week, so we're able to see Mondays, Tuesdays, and Thursdays individuals who, as long as they are uninsured and are low to moderate income, then they're able to come to the clinic. The application process is very easy. It's basically a health questionnaire. We do ask for a photo ID and a piece of mail that shows where they reside. But for the most part, it's a pretty easy application. And
I know you mentioned a website, and if they can call up the website, we can take a look at it, because that's when you have a lot of information there for people. And of course, today with the internet, everything can go to the website. And you mentioned how to contact you, perhaps how to make an appointment.
Right.
So if we could take a look at the website that they have, and this is something that I'm sure that you reach a lot of people through the internet and social media as well. But here's the website. So.
Definitely, and right there, the Community Clinic Patient Portal. They can click on that and request additional information from there, and that will send an email into us and give us that heads up that we will then call them. Or the quickest way is just to stop by the clinic or to call us, and we can either mail them out a packet, or they can come in and pick up that packet. So it's a fairly easy process. Our dental is the only program that we really have a waiting list right now, and that typically is about 2 months to get in for a dental extraction. But if somebody has a pain associated with dental, we can get them in fairly quickly to get them on an antibiotic to deal with that infection and the pain, and then they're able to come back. And there's actually a picture right there of us doing at St. Paul's. We did testing for their staff and volunteers. So. With our Facebook, we really try to share information. We share information about what's going on with our community partners, but we also share information about COVID and how to protect yourself and how to take care of the things that need to be taken care of along those lines.
So are you in a lot of communication with the county and city health departments as far as with the COVID situation, and regular communication and finding out what's happening in our community?
Yes, definitely. We have such a great both our county and our city health department. I feel for them. They have their a lot of people, and they have a lot of people with different opinions that I think it makes it hard for them to do their job. But they have been doing a really great job of trying to get the word out and trying to educate the citizens and trying to get all of the information that they can to people. So we work really closely with both the city and the county, as well as Newton County, McDonald County is, and really trying to and also sharing our resources. We've been partnering with them to try to help with some of that back, whenever there is somebody that tests positive, if it's one of our patients, trying to help them with getting information for that individual and that type of thing.
Well, we've been talking about all the services. People are probably wondering, well, how can they afford to do this? And, who runs it? As you say, nonprofit, so you're not tied to any governmental agency.
Right. And we actually choose not to receive any government funding. So, there's all kinds of government grants out there, and we choose not to do that. We started as as part of the Presbyterian Church in town, and it wasn't not officially part of that. It was just a group of people who came together.
Kind of an outreach for their church.
Right. And it's grown from that time. So we have a lot of community partners that really, like Mercy and Freeman, are both two very dedicated community partners that help us. We have several different private foundations and grants that support us. Our patients do tend to make a donation for their care. We don't require that, but we do accept their patient donations. And then we just have people who just are very giving. We have several churches that every month we get $100 or $200 from their tithing. And it's just been a very wonderful and blessed kind of an organization that just relies on our community to support.
So really that word community really standing out.
It
That
is.
People, and the volunteers. I mean, you obviously have the volunteer doctors, you have people behind the scenes helping you staff-wise, and we don't see when you go into perhaps a medical appointment.
Definitely, and a lot of times they probably assume that they're paid employees. So, we have a small staff of about 11 part-time paid employees, and then beyond that, we have a lot of retired nurses who come in and volunteer. We have some students who are in nursing school or in medical school who want to come in and they help us with volunteering. We have different. Right now, we have a student from Oklahoma State University who is there for the summer, and she's doing a lot of work for us. So we have a wide variety of volunteers. We even have a physical therapist who comes in and provides physical therapy volunteering.
Volunteer basis.
So, yeah.
People giving their time to help others.
Exactly.
For the community at large, if somebody wanted to give financially, are there means for them to donate to help with the clinic as well?
Certainly, we have both a donate button on our Facebook page as well as our website. We also, they're also able to send in a donation to us. Our donations are tax deductible, and we're always happy for any kind of assistance. We have some people who we give out hygiene kits. So, some churches will do a hygiene drive for us, and they'll get deodorant and soap and toothbrushes and toothpaste. All kinds of things like that benefit our community and our organization.
What if someone were to ask you, what are your greatest needs right now? You're talking about how community and people can help. Is there anything particular that stands out in your mind as far as needs for the clinic?
I think for us, those small donations really add up. So those, individuals who say, I really would like to give $10 a month to the community clinic, that really adds up for us. And then, we like to give our patients that come in, we like to have groceries for them. Not big groceries, but we like to have fruits and vegetables and things like that. So if we have people who have big gardens and they want to bring some produce to us, we love that kind of thing. And office supplies, we're always needing, there's endless amounts of paper, there's endless amounts of, all of those kinds of things. So those are always valuable. And then whenever, COVID gets hopefully further past, more volunteering, especially those general kinds of volunteering. The nurses who would like to come in and help out. Right now, we're blessed with a full slate of doctors, but eventually having some additional nursing volunteers would be wonderful.
So do you see a time in the future where you're going to have to want to expand the hours or that you have available? I mean, you're pretty much filling up the days now.
Right. And right now we only do specialty clinics on Fridays. So, we have the availability if finances and everything else were there to be able to expand to opening full days on Fridays as well. And that might become a thing for us in the future.
Now you have daytime. What about any nighttime needs? Are there some people who say, well, I can't get there in the daytime, I need nighttime help?
Right, and we do have some nighttime clinics. Like this evening, we actually have one of our cardiology clinics this evening. So it's from 5 to 7 p.m. tonight. And, we have some pulmonology clinics and some of our general clinics that will go into 6 p.m. at night. So we do try to, have the hours that meet the best needs for our patients. Occasionally we'll have Saturday clinics as well. The Islamic Society of Joplin has been really great, and every quarter they'll do a big Saturday clinic for us, and they'll have 5 different specialists that will come in and they'll see patients on that Saturday. So we really try to diversify our times that are available and diversify what we can offer to our patients.
So being able to adapt as the needs approach in the community and so forth. Well, we've been talking a lot of statistics and numbers without giving any names. Can you share maybe a story about a patient who said to you, this really made a difference in my life, or how those success stories?
We have a wonderful one, and this is somebody who started off as just she was actually a homeless woman in our community, was not a patient of ours initially. She would just come in to get out of the cold and to access our Wi-Fi to be able to communicate. Early on, she may have been diagnosed, but she was untreated with significant mental health issues. And you couldn't have a normal conversation with her because she was talking nonstop, but it was not to somebody, it was to herself. And she had been coming to the clinic for a couple of months, and we were slowly trying to get her to feel more comfortable with us. Eventually, she ended up realizing that she needed some help, and she ended up in the hospital, and we were able to help facilitate that. She was able to get medication for her needs. We were able to then get her stabilized. We helped her to seek employment. She got a job. She had been homeless for 6 years. So she's now living in an apartment, has a job, is coherent. She comes in and says how she's amazed that how far she's come in such a short time, and we're amazed. We wish that we had video of her before to show this transformation of this woman. And she's somebody who was very successful previously, and she had a major issue in her life that caused her to become homeless and caused her to no longer seek care for her mental health issues. And the assistance of her coming into the clinic and us being able to say, we're not just a doctor's office, we're also here to take care of your whole being. And we had one staff member who took her around to look at apartments, and we had another staff member who helped her to get her birth certificate. And these are things that a typical doctor's office wouldn't have done. And she's now doing great. And she says that she says, I feel like I have a life again, and those are the kinds of things that every day we can, at the end of the day, we say, okay, we had impact on this person.
So really rewarding for you and your staff. And imagine that at the end of each day, you can look at the number of patients who came in and the statistics, but you could say, I made a difference in John Doe or Sue Smith's life today.
Right. And there are days whenever you're like, okay, this was a hard day, but then you remember, we really, this is somebody who really has a whole different life now because of her coming into the clinic.
Great. Yeah. Well, as we wrap up, if somebody's been watching Tuned In Late, how do they find you? How do they get more information in this community clinic?
So our website, they can go to that, our Facebook page, our phone number is 624-5500, and they're always welcome to call me. My email is stephanie@joplinclinic.org. I'm always happy to come out and talk to people, talk to different organizations about what we do. When COVID is a little bit further on down the line, we'd love to have people come and tour the clinic, come and visit us, and whether you're somebody who's needing care or whether you're somebody who just wants to learn more about us, they're welcome to come and see who we are. We're 7th and Joplin, right downtown.
I just showed on the map. They're easy to find in Joplin.
Very easy to find.
So, and you've been there for a while, so that helps people identify that location.
Exactly.
Finding them together. So, well, Stephanie, I'd like to thank you very much for visiting with me today, providing information for our audience. And
I appreciate it. I appreciate it very much. Thank you.
You're welcome. And I'd like to thank you, the viewers, for joining us this week on Newsmakers. I'm Judy Stiles. Hope you can join me again next week at the same time on this station. We'll see you then.